Going to talk about my research project for the racial and ethnic minority class, and my title is Utilizing Communication Technology to Enhance Social Interactions Among Older African American Individuals, with the goal of delaying cognitive decline and the onset of Alzheimer's disease. My name is Jalaluddin. I use the pronouns he, him. I am an MPH student at the UNLV School of Public Health at the Department of the Social and Behavioral Health. I am also working as a graduate research assistant at the UNLV School of Public Health. So let's talk about the background and significance. What is Alzheimer's disease? Alzheimer's disease is a type of dementia that affects memory, thinking, and behavior, which is accounting for 60 to 80% of dementia cases, and its prevalence is expected to increase with the aging populations. By 2050, approximately 13 million people are expected to live with Alzheimer's disease in the United States. African Americans tend to have an earlier age of onset and more severe symptoms of Alzheimer's disease compared to non-Hispanic whites. Additionally, they are less likely to receive Alzheimer's treatment, and Black adults are 64% more likely to develop Alzheimer's disease and related dementia compared to the non-Hispanic white adults. So what is my research questions? My research question is, what is the impact of using communication technologies to improve social interactions on slowing cognitive decline and delaying Alzheimer's disease development among African Americans older adult? So I have three specific aims for this project. Number one, to examine the effect of video chats with multiple trained conversational staff on cognitive functions and emotional well-being. Secondly, to investigate the factors contributing to the onset of Alzheimer's and cognitive decline in older African Americans. Thirdly, to evaluate the effectiveness of communication technology in slowing cognitive decline and delaying Alzheimer's disease development in African Americans. Now let's talk about the hypothesis. So I have set two hypotheses. Firstly, the use of communication technologies will improve social interactions among African Americans older adult, which will result in a slower rate of cognitive decline and a delay in the development of Alzheimer's disease. Secondly, addressing barriers to technology adoptions and sustained use such as cost and access will be essential in achieving the potential benefits of communication technologies for African American communities. So, I followed a theoretical model which is called social-ecological framework that is consists of individual, interpersonal, community, and social factors level. The model suggests that improving social interaction through communication technology can positively affect cognitive functions and delay the onset of Alzheimer's disease in older African Americans community. My project will apply the socio-ecological model focusing on the interpersonal level to investigate the impact of user-friendly video chats with trained conversational staff on cognitive function and emotional well-being. The aim is to determine if this intervention can help delay cognitive decline and the onset of Alzheimer's disease in older African Americans. So in terms of some previous study done regarding the projects, so the study were identified through searches of PubMed and Google Scholar between 2013 and 2023, as well as scanning the reference list of selected publications. In 1998, Brookmeyer and his colleague suggested that enhancing social connectedness or interaction may slow down age-related cognitive decline and delay the symptomatic expression of Alzheimer's disease and related dementia. In 2015, Dodge and his colleague conducted a feasibility study on the effects of conversation-based cognitive stimulations on the cognitive functions of older adults without dementia and found promising results. To further enhance cognitive functions, an ongoing randomized control trial targets socially isolated and lonely older adults, as cognitive function can be improved when activities are novel to individuals. So here is the method of this study. So I will go for a randomized control trial study where around 310 social isolated older Black African American over the age of 70 will be included. And I will select the participant from the community in state of Nevada, either by the video chat or intervention group or the control group. So my inclusion criteria are consisting of age 70 or older Black African Americans, participants who has adequate visions and hearing to use study technology, participants who have sufficient ability to understand English in order to complete protocol required testing. And here is my exclusion criteria. I will exclude the participants who are severely depressed, operationally defined as a 15-item GD score more than 7, significant disease of the central nervous system, for example, brain tumor, seizure disorder, and mental unstable or significant disease of the central nervous system. Any severe condition that could adversely affect the participants or study team's involvement in the study. In terms of my interventions, my aims to examine the effect of video chat with multiple trained conversational staff on cognitive functions and emotional well-being. So let's talk about the session of this project. The experimental group receives 35-minute video chat with trained conversational staff 4 times per week for the first 6 months, which is high dose, followed by 2 times per week for an additional 6 months, which is called maintenance dose, and weekly check-in calls that monitor social activities and adverse health events. The control group received only weekly check-in calls. So, what are the strengths and limitations of this study? So, the strength of these interventions. Based on a socio-ecological model that considers multiple levels of influence on health outcome by focusing on the interpersonal level, the intervention seeks to address social isolation, which is a significant risk factor for cognitive decline in older adults. It is user-friendly, as it uses video chats with trained conversational staff to improve cognitive function and emotional well-being. In terms of limitation of this intervention, I will say not accessible to older African Americans who are not familiar in technology. This study does not cover other facets of Alzheimer's disease, including the progression of the disease and physical symptoms. Reliance on conversational staff may pose a limitation in terms of scalability and cost effectiveness. So here is the conclusion of my study. This study focuses on utilizing communication technology to enhance social interactions and delay cognitive decline and the onset of Alzheimer's disease. By utilizing a socio-ecological framework, the study will evaluate the effectiveness of video chats we trained conversational staff in improving cognitive function and emotional well being among older African Americans. The finding of this study will shed light on the potential benefits of communication technology in delaying cognitive decline and Alzheimer's disease development in these populations. So, here are my references. Thank you, everyone.